Ja, mach ich gerne. Super.
Okay, good evening, ladies and gentlemen.
Ganz vielen Dank.
Tonight,
Danke.
welcoming.
Eleuthera, you're on mute.
Oh, sorry. Okay, welcome everyone. Tonight we welcome Dr. Charlotte Clarke, who is a professor of environmental epidemiology, director of the Population Health Research Institute at St. George's University of London. She has an international reputation of conducting robust policy-relevant research on the effects of environmental noise on physical and mental health, well-being, and quality of life. She currently leads the Department for Transport Aviation Night Noise Effects Study, the first UK study of the effects of aviation noise on sleep for over 30 years. She also leads a study funded by Heathrow Airport, managed by the NIHR, examining the effect of school noise insulation program on children's health and learning. She has written several influential systematic reviews synthesizing the evidence for noise effects on health for the World Health Organization and DEFRA. She has managed large-scale adolescence epidemiological cohort studies like RELAX and ORIEL, as well as analysis of national cohort data such as the 1958 cohort. Charlotte is president of the International Commission of Biological Effects on Noise, ICBEN, and a member of the Civil Aviation Authority Environmental Sustainability Panel. Tonight, she will speak to us about the impact of aviation noise on children's learning. Dear Dr. Clarke, thank you for being with us tonight, and the floor is yours.
Thank you. Thank you for the invitation as well to talk tonight. I'll just share my slides. Hopefully you can all see my slides.
Yep.
So I'm going to take you sort of through a 20-year history of what we know about the effects of aviation noise on children's learning. And I should also say, as well as being in the university, I did work as an environmental consultant for 4 years. I work a lot with communities and actually in government. And I really just wanted to start by saying that I say the same thing to everybody about the effects of noise on health. It isn't that my messages change. I try and deal with all stakeholders so that everybody's informed. And so I probably don't need this for this audience, but really over the 20 years since I started in noise and health, it's been increasingly accepted that sound is an important public health issue. And if I think back just to when I started 20 years ago, people thought you were slightly mad when you said that noise could affect people's health. But actually we have seen that change, and I think the effects are now accepted. And I won't give too much background about noise and health because I know you're aware, but I did want to just a couple of recent developments. So Daniel Fink in the USA has set out this nice definition of noise that I think is really helpful to our field. And he defines noise as unwanted and/or harmful sound. And I think it's useful if we keep that in mind because the harmful bit has really been added and is important. And this has been adopted by a few public health associations and also by ICBEN, which is the International Commission on the Biological Effects of Noise, which I'm president of. We have adopted this definition of noise. And I know you're all used to dealing with noise, but I got a bit fed up of those decibel things where they show you individual items, you know, so they tell you that a jackhammer or a drill is about so many decibels. But really what we're dealing with is people exposed to noise levels over a very long period of the day or the night in everyday settings. And then thinking about how does noise influences our biology, our health, it can be quite challenging, difficult for people to understand that changes in physical waves, which is what sound is, in physical phenomenon can actually influence you biologically. And one way to think about this, I think if I got a pointer, let me see. We think about, we have annoyance. So if you hear noise, it might be annoying. You might be trying to talk to your partner. You might be trying to read a book, have a conversation, just want some quiet time. So your activities become disturbed and that annoys you. And people think that that annoyance isn't a health effect, but it is a health effect. And in noise research, we treat that as an outcome. And actually most policy and guidance annoyance here in the green is what people are really focused on. This is what politicians focus on. And obviously, if you're annoyed, that can lead to stress responses. And I'll talk a little bit more about them in a minute. But also noise at night can influence your sleep, can cause you to wake up. It can also mean that you just have a poor night's sleep. So if I ask you the next day, how well did you sleep last night? You may say good, bad, but you have a reflection on how well you slept. All of these things, so both annoyance and sleep, cause biological responses. If you're annoyed, you get the release of lots of stress hormones, but also if you're sleep disturbed, your heart rate goes up, you also get these stress responses, but your cardiovascular system increases its output. So it's like you're running it harder than you should. And over time, the stress hormones and these cardiovascular changes, they can all lead to longer term outputs. So for example, you might get high blood pressure, stroke, vascular dementia and things like that. So you get to these very horrible, hard health outcomes at the end. And as I said, that is really all through stress. And obviously, if you think your sleep's disturbed, that's stressful for you as well. But moving on to focus on children. So I've got a few slides that deal with the evidence as it stands about whether children attending noisy schools have poorer learning and health. And I've focused on aviation, on aircraft noise for this, and the evidence is a bit different if you were looking at road or railway. So I want to talk firstly about what we call the Ranch project. And this was a European project that I worked on 20 years ago. And Ranch stands for Road Traffic and Aircraft Noise Exposure and Children's Cognition and Health. And at this time, Stephen Stansfeld, who led this project, he had done 2 smaller studies around Heathrow Airport that looked like they might be an effect of aircraft noise on children's learning and health. But this was designed to be a much bigger study so that we could statistically test better the relationship. And the aim of this study was really to see if there was an exposure effect relationship between aircraft noise and children's health and cognition. And we also looked at road traffic noise. So we're really interested in when children go to school, do they do worse in tests of cognition or report poorer health than children who go to quieter schools? And the part of the study was carried out in 3 European countries. So that was the Netherlands, Spain, and the UK. So it was around Schiphol, Madrid, and Heathrow airports. And the same study was carried out in each country so that we could combine the data and look at it. And we also got the parents to report a wide range of factors that might influence how much noise you were exposed to at home, and also how good your learning outcomes might be anyway. So things like your income, the mother's education, and some of the situation in the household. And so this is just to show you some pictures. They look quite dated now. So we went into the school and we had the children for a whole morning and we did a range of tests of their cognitive skills. So things like memory, reading comprehension. We also measured their mental health. And during the class, we did a lot of surveys at the school, so acoustic surveys, and we also would measure the noise during the testing session so that we could take that into account. And I won't go through all of this, but if we just look at the pooled sample, we got nearly 3,000 children took part, and that was 89% who were invited. We also got 80% of the parents of the children to do the questionnaire, and that's quite important because you want the findings to take into account these other factors. We were focused on children who were 8 to 10 years old. And as you can see, we went to 89 schools across the 3 countries, and the aircraft noise ranged from 30 to 77 decibels using a 16-hour LAEQ average noise exposure. And that was one of the novel things with Ranch, is that we went down to very low exposure so we could look across a really wide range. Before that, studies had tended to choose schools with noise and compare them to schools without, but we were interested in the relationship across. And when we looked across the 3 countries' data, we did find that aircraft noise at school was associated with poorer reading, poorer memory. The children had higher annoyance, and they also had higher levels of hyperactivity symptoms. And I'll show you the relationship for reading in a minute. That relationship that I'm about to show you is still used internationally to assess in health impact assessments for airports on children's learning. And so this is the key finding, well, this is one of the key findings from the Ranch study. So along the bottom on the x-axis, you have aircraft noise in the school for the 16-hour period. And then on the y-axis, you've got the reading score. So each country did obviously have a test of reading in their own language, and we then were able to combine the performance. And what we found was that you can see as aircraft noise increases, the performance, the reading score goes down, so their reading gets worse with higher aircraft noise. And that reading fell below average at around 57 decibels. And across the data, we also found that the children's reading age, which is a more standard assessment of how children's reading is development, was delayed by 1 to 2 months for a 5 decibel change in the exposure. So there's quite a lot of detail there, but I'm really happy to show it again later and have a discussion if that helps people to understand it further. And later on, we did lots of extra analysis with Ranch. We showed that the results were not explained by air pollution. I followed the children in secondary school into their next school, and it looked like there was a continued poorer reading outcomes for children who also went to secondary school. And a few years ago, once I'd started working in consultancy, I realised that it was quite difficult for people to use this in health impact assessment. So I was doing a lot of health impact assessment work for airports. And I actually reanalysed the data, and I added in the 2 earlier studies from around Heathrow. So combined 3 different data sets for UK and re-estimated the effects. So again, these show you aircraft noise along the bottom at the school and reading score. And you can see the result looks very similar across the 3 studies when you combine it, that as noise increases at the school, so does children's reading get worse. And I also analysed it to look at whether children were scoring well below or below average. So on the right-hand side here, This is showing you that as aircraft noise at school increases, the probability that children are going to perform well below or below average increases quite substantially. I think their odds of performing badly went up by 4% for every decibel, 1 decibel increase in their noise exposure. And I did that analysis really because I think it's politically more convincing for people to think in terms of how children perform below average on the test. So why do we think this happened? I mean, Arlene is an expert in this. Arlene did some of the first studies of railway noise on children's learning. She'll be familiar with all of these and worked really with the teams that came up with these. So there's a theory that children tune out. So if you have the sound constantly, you might stop listening, you might stop paying attention, and actually that might include that you tune out the teacher who's trying to advise you. Obviously, it's harder, it's difficult to hear and to understand speech when it's noisier. There's also the idea that actually teachers struggle. It's difficult for teachers and they may get frustrated, put in less effort, and you've also got communication difficulties. Children can also experience what we call learned helplessness. And so this is understanding that you don't have any control. So you actually stop trying to make any change or to make the situation better or to cope with the situation because you know you can't control the noise. And there's also the idea that actually children often also exposed to noise at home. So they may have aircraft noise at home and at school, which might mean that their sleep disturbance means they perform more badly at school anyway the next day. And it can also impact your mood and lead to you having stress responses. So that sets out really the key evidence from Ranch about how aviation noise influences reading. So what do we know about what might you do if you're in this situation that you have children exposed to aviation noise? So do interventions work? And Arlene, you'll be pleased to know I'm focusing only on aviation noise, so don't think I'm omitting your wonderful railway noise studies. So you'll be aware I've just started with the WHO guidelines. So for aircraft noise, it is set at 45 decibel for a day, evening, night, and 40 decibels at night. So I did a systematic review and evidence review that fed into the environmental noise guidelines on children's learning. I still think it's a shame we don't have a daytime level in the WHO guidelines. That's to do with our European regulation, which focuses on LDEN. But when dealing with schools, it's a little bit of a disconnect. You don't have the metric really that makes best sense. So how might you achieve those levels? They are incredibly low. So what do we know? This review by the WHO as well, and I've cut this down to focus on aviation, on aircraft. You've got options to reduce at source, so you regulate emissions. You might put curfews on flights, but I think that's really used more for nighttime flights, which might impact children's learning less. You can think about how you manage the airspace. Really, most interventions for aviation noise come down to insulating the residences. When you think about it, that's generally what people get offered. You may be able to move flight paths and you may have some urban planning control. For many existing airports, urban planning is not really, it's not an option. It's too late once you're up and operating. It's really difficult. And there's also ideas that having a quiet side to your home, so having somewhere in the home you can go to be quiet, is useful, but that's more difficult for aircraft noise than perhaps for road traffic noise, where when the source comes over you, it's quite a challenge. And there's also increasing thoughts, and I'm doing some work on this, that if you've got somewhere that's a green space, a local park, that might be good for you, and that might remedy these effects. I think the evidence is not great. There's an assumption that all green space is quiet, which is not the case. But focusing a little bit more on aviation noise. So when this was published, when we published the Ranch study in 2005, you couldn't really get Heathrow Airport to admit that they made any noise. They were not very happy with the findings of the study. But in time, they did start to try and do some work in local schools. So they accepted there was evidence and that there was a problem. They came up with these igloos, which were called adobe huts. And the idea was that the children this could be an outdoor classroom and that children could play in it. John will be aware of these. I think we were all quite surprised by these. They were not evaluated in terms of whether this improved children's learning. So this is just really to show you that was Heathrow's approach. But Heathrow then started to insulate schools. They did roof insulation, they changed windows. So it started a program of insulation, and I'll talk more about that in a minute. But there's not been many studies of aircraft noise interventions in schools. This is one of the best ones we have from Staffan Huger, Gary Evans and Monica Bullinger. So the Munich airport was moved, and so what this team did was they managed to look at children in schools who lived near the old airport and children who were going to live near the new airport. The airport then moved and they went back and looked at these children again. And so before the airport was shut, they found aircraft noise was associated with poorer long-term memory, reading, and greater annoyance. But then after the airport closed, those effects, those poorer learning outcomes disappeared. They went away after 2 years of the airport closing. And what's really interesting is that the children who were newly exposed to the aircraft noise developed those cognitive impairments. So their reading and memory got worse once the new airport opened. So this suggests that you can reverse the effect if you can remove the noise, which I think is a very strong evidence. It's quite rare, though, that you remove the noise in this way. It's quite rare for an airport to shut. And you also have to think that it's likely to move somewhere else. So you've just moved the problem round, really, rather than reduced the noise in totality. Then there are a couple of really interesting studies funded by the Transportation Research Board in the USA. This is a quick summary of one of them, where they looked at 6,000 schools who were exposed between the year 2000 to 2009 at 46 US airports. And they looked at the standardized academic tests for those schools in children in grades 3 to 5. And they found that aircraft noise was associated with poorer mathematics and reading performance. And what was really interesting in this study was that 119 schools had also been insulated, and they knew when. And when they looked at these standardized tests, they found that the effect of aircraft noise on the children's learning disappeared once the school had sound insulation. So because they had data over 9 years, they could look before They knew when the insulation went in and they could compare to after. So that's this study is probably less well known. Because you're dealing with school level data, you miss data on the individuals, which is problematic, but I still think it's evidence in the right direction that if you can insulate schools, you should improve children's learning. And then just finally, I'm currently funded by our National Institute for Health and Care Research to evaluate the scheme around Heathrow Airport. So this study I've been trying to do for, well, at least probably 20 years. It has a long history. When Heathrow started insulating schools, we went to them and asked them if we could do a before and after study. So could we look at the children? They then insulate the school, and then we go back and see if the learning has improved from the start. And it's gone through lots of versions, but we're finally now starting. And our aims are to see whether insulation improves standard school tests. We're also looking at whether the effects, if you see improvement in children's learning, does it go across all children? Are certain groups more vulnerable to the insulation not helping them? We're also going to look at cost effectiveness, which hasn't ever been done. Heathrow are spending millions of pounds insulating schools, but they don't know if it works. And that's quite a difficult position to be in. Insulation in the UK for planning is usually really the only thing on offer, and we don't know if it works. And we're also within this study going into schools and doing a before and after. So we're going into schools before Heathrow insulate them to collect data from the children. So we'll be using exactly the same ranch cognitive tests and that method. And then we'll go back after a year of the children being taught in an insulated school and see if we think their learning has improved. And then just finally, I don't know how aware you are as a group about burden of disease, but this type of research gets used in planning and also to estimate across your population what impact is noise having on the public health of your population. And for a long time, I was really irritated because burden of disease never included children. It would always focus on adults, and it would focus on a few health outcomes. It still does that to a certain extent, but recently this report, and I'll share these slides so people can look up the links. This report was published by the European Environment Agency, and they've used my ranch reading relationship to look for to estimate for aircraft noise. They've also included behavioural difficulties. So you remember I mentioned hyperactivity before. The two key effects of aviation noise on children are on reading and on behavioural difficulties, which is things like hyperactivity at school. These estimates only consider people exposed above 55 dB using an LDEN, and they also only include airports with 50,000 plus or more movements per year. So you see, if you look for reading ability, the effects is quite small here. So in total, there's 7,000, nearly 8,000 children per year who would be having an impact of aviation noise on their reading. But this is an underestimate because you're only looking at people exposed above 55 decibels, and we know the effect is linear for reading, so you're not counting everybody. And you've also got that restriction on the airport movements. So it's a start, but we do think this is an underestimate. But I think the other message, which is probably less interesting to this group, is really just how aircraft noise gets a lot of the focus, but actually road and rail have a much bigger impact on, and this is also true for adult health, on both children and adult health. And then I just wanted to share this link. If anyone's very new to noise and health, I was lucky enough to do a programme with the BBC, and it was called Can Noise Harm Our Health? And it really takes you through how sound can influence your health. We have a good, do some cognitive testing in the lab and play sounds at the journalist. And I think it is a really nice introduction to noise and health for people who want to learn a little bit more. And I'll leave it there. And I'm sure I've been too technical in places. I'm open for any questions or anything at all people want to ask.
Charlotte, thank you very much indeed. That was that was really excellent. I think if you stop sharing your screen, we can all see each other, and people feel free to put on your cameras, because it always looks like a proper meeting then. And I have muted everybody, so you'll need to unmute yourself when you speak. And just to say, before I bring David in, I see your hand raised, and then Elaine. For me, it's easy. For Charlotte, it's easy. Our mother tongue is English. But if your mother tongue is not English, and that's most people here, don't be afraid to speak up, because you are amongst friends, and we'll help you out where we possibly can. Right, David, you got your hand up nice and promptly, so on you go. But unmute yourself, otherwise we won't hear your words of wisdom.
Is that better?
That's it. That's it.
All right. I've been texting back and forth with Dan Fink since you began, Charlotte, and I want to thank you for crediting him on the definition of noise that includes the word harmful. But I did want to make you aware that the word harmful was introduced to us by Arlene Bronseth's grandson, as a matter of fact. She asked him what he would do, and we began to build that into definitions in the US. So Dan Fink's paper and his work on the word adding harmful to the definition of noise it came directly from Arlene Bronseth's grandson.
Oh, great. Excellent. So that's really nice bit of history. I didn't know.
That was in 2018. So it's been, 6 years now. I have a question which has to do with your other activities related to this. And this will be of interest to Elaine Miller, who also works with us here as well. So I know her well. But it has to do with the definition of noise, which is the big impediment in this country anyway. The idea that noise is merely annoyance, I put those two words together, merely has always defined noise ever since they took over the EPA's noise portfolio back in 1981. So merely annoyance prevents anybody in this country from being able to do anything about it, because annoyance is not considered a health problem. It's merely annoyance. It doesn't matter. And it has no legal classification that's of any use either. You can't go to court on annoyance. And so it's prevented any kind of forward motion with respect to policy on the noise issue in the US. And that's what started us working on redefinitions of things. Well, just today and a couple of days, Dan Fink and I have been working together on a paper he's writing. And what came up was called ICD, International Disease Classification of Diseases, which is published by the World Health Organization. The ICD is, I know of this, there's one for psychiatric disorders called DSM, Diagnostic and Statistical Manual. And we've tried to get them to look at the definition of noise, to accept it, as a matter of fact. But I just learned that there is such a thing as ICD, and that there's an American counterpart that's published by the American Medical Association. And so we're looking now to see what is their definition. So do they classify noise-induced hearing loss as something that's different from age-related hearing loss? That's a major distinction. as we found, because we've discovered that in this country anyway, audiologists, people who are part of the otolaryngology HNS profession, generally dismiss the idea that noise-induced hearing loss has any appreciable effects on anybody's health, because most noise isn't loud enough. And they cite the American agency OSHA, which basically says you're only harmed by noise if it's greater than 85 decibels. Ergo, aviation noise is no problem whatsoever. That's
Okay.
the conundrum we face in this country. Nothing is harmful above 85 dB by profession.
It's a real problem, David. I will bring Charlotte back in, and then you can come back if you wish.
Okay.
Yeah,
I want to know if you or anybody else has been working with ICD on this problem.
Okay, that's the question. Yeah.
So noise is really unique in that we have annoyance. We have an international standard as to how we assess annoyance. I won't go into, I led the revision of that, but it's still quite problematic, I'll say here. It does not have an ICD. We're up to ICD 11 now. It teaches to the medical students. It's not in there. I think your chances of getting it in there are quite slim, because I just think we have this standard that measures it, but the medical approach would be very different. The medical approach would be, what are the key symptoms for this disorder? How many of them do you need to have for you to tick the box for me to say, John Stewart, he's been diagnosed with noise annoyance. I'm not against it, but it's always, I work in a medical school, and whenever I talk about annoyance, you can see all the medics thinking that this is not a proper health outcome. I almost, and that I don't agree with that, but I admire you and Dan taking on the challenge of that, and I'm happy to help any way I can. I think one other way around this annoyance issue is that the evidence for what annoyance does to your cardiovascular system and your sleep has improved so much in the last 20 years that might be the easier route through, because there's a whole host of ICD-11 codes for the various cardiovascular effects on you. Medics won't argue with those, policymakers won't argue. So that's just, I mean, I'm happy to have a further chat with you. I think it's worth a try, but I think it would be really challenging.
Thanks, Charlotte. Elaine has got her hand up, and then Arlene's got her real hand up. So we'll go in that order.
Well, thank you very much, Ola, for a great presentation today. We all enjoyed it very much, and all the information that you have given us, which we have been working on diligently for many years. These are my questions for you. When you did the original ranch study, you said that the decibel levels that you collected were outside the school, or was it inside the school?
We did both. So we had contour, or we modelled noise outside at the schools, but we measured noise inside the school, both when the school was empty, but also during testing session. But the graphs I show you are external, and that's for the reason that policy tends to be set on the external noise. So that's why. But actually, with the new intervention we're doing, we're going to look a lot more at inside to outside noise differences and things like that to explore that in more detail.
And my other questions, I have two other questions. I hope you don't mind.
Yeah, no.
Did you collect data on the altitude of the planes, the altitude of the flights?
No, it was done on time average over the 16-hour day. So it wasn't, obviously there would have been a variation. Some schools were right at the end of the runway, as John will know, and others were further out because we had a whole range. So no, we didn't. These days we would look at least, we could do that more easily. Back then you couldn't. We would probably look at some number of above metrics these days as well.
And the last part of, because things have changed so much, especially here in the United States, there has been a definite increase in the amount. So frequency, were you to determine the frequency of the plane? One every minute, one every 90 seconds, one every 2 minutes, etc.
So the American study I showed you of 6,000 schools, that looks at time above metrics, and it looks at number of event metrics. And what I'll do, it's quite difficult to find that report. I will make sure to share a link with you so that you can go and look at it. That all the metrics we've looked at show a similar effect, which I think you would expect. But I completely understand the interest on the number of events and the time above and things like that. So I'll share that. I should have put that on the slides.
Thank you very much.
Brilliant. Arlene, you're on mute, so you'll need to unmute yourself.
I'm unmuted now?
You are unmuted now, yes.
Okay, thank you, Charlotte. Let me just go back in time. I want people to understand that my study on the effects of elevated train noise on children's learning was published in 1975. That was 50 years ago. And anyone walked into the school, they would have known the noise was affecting the children and disturbing the teachers, whom I also interviewed. But it took a study. But let me give you the positive side. It was the city's Department of Environmental Protection that did all the measurements for me on that study. I'm not an audiologist. I'm a psychologist, all the measurements. The school was very receptive to my doing a study. Terrific principal. I don't know if that would hold today. But I think the more remarkable thing about it is that when the findings were published in a peer-reviewed academic journal, and it showed that children by the 6th grade were nearly a year behind in reading, action was taken. Dr. Bronzaf, we need another study. We need to look at other schools. Nobody said anything like that. I was able, joined by parents, community, public officials, the media, to meet with the Transit Authority. They were testing out a method to lessen the noise on the track. I asked to choose the school. They did. We went to the Department of Education. They put acoustical tilings in the ceilings. Imagine, this is early 1980, action was taken. And then after the abatements were in place, I was asked to go back, take the measurements, and see if it helped. And lo and behold, what a finding. When things were quieter, the children did better. What really disturbs me, and Charlotte, I thank you for continuing the interest because we're still not there yet, that we not only had the data, but we took action. I'm going to hold up a book that was published by EPA. It's called Noise, a Health Problem. It doesn't say, is noise a health problem? In fact, it says, it is finally clear that noise is a significant hazard to public health. Truly, noise is more than just an annoyance. August 1978. And if you look at this booklet, and yes, they were so up to date, they quoted my study. They said calling noise a nuisance is like calling smog an inconvenience. Noise must be considered a hazard to the health of people everywhere. So here I am. I'm glad I was able to get older. I'm not frustrated because, you know, John, I still work on this. But here we were 50 years ago. The city not only looked at the data, it cooperated, it abated the noise, it took action. What has happened over the years with more and more studies, Charlotte, there's so many more studies today than when I did my study in 1975. With more data, strong data, and you'll agree, on the impacts of health, well-being, learning, all the data, we still haven't moved sufficiently to the action. Yeah. It's not the ways. We know the ways. Look how quickly the Transit Authority was able to quiet things. You gave suggestions on what the airports could do. It's not the ways that are lacking. It's the will.
Okay.
Sad.
Thanks very much for that, Arlene.
Thank you.
Charlotte, do you want to come back on that?
I mean, I very much message now that we don't need to show that. When I started 20 years ago, it was all about, can we show there's an effect for aviation noise, I think in particular was. I message now and that we know there's an effect, we need to do intervention studies. But what really irritates me is that it's taken 15, 20 years to get the money to do this study, which means the method is not the best because they've already insulated the schools. It's really difficult to get this stuff funded. And one other challenge is that people, and I found this as a consultant, your client doesn't want you to tell them that you don't know if their intervention works, right? They've usually had to go to somebody to get lots of money to do whatever it is they think is the best thing to do to solve this problem. The last thing they want is Dr. Clarke over here then going to them, oh, you spent all that money and it didn't work. And that scares people. But actually, it's the only way we're going to move on. And like Arlene says, we rely on these mitigations to protect people. I also just quickly, one thing I think, road traffic noise is everywhere. And it's so difficult to mitigate. There's often not one fix for noise as well. And I sometimes think it's the problems you would have with mitigating that exposure can hold back doing something for railway noise or aircraft noise that might work as well. So yeah, I agree, Arlene.
Yeah, that's very interesting, Charlotte, what you said about rail and rail and road. Richard, you've got a question in the chat. I think if you're still here, do you want? It's about the exemptions from that aviation enjoys. Do you want to ask your question?
Hang on, sorry, I was just on mute. Hi there. Yeah, I mean, I think it is recognised that noise is harmful, and in the UK we do have some legislation in place which protects us from noise. I think such as what? I mean, there is a Noise Act. I don't know the exact year that Noise Act was actually implemented.
1996 or 1997.
But at the same time that Noise Act was introduced, it was also stated the aviation industry had exemptions from that act. And the aviation industry has then gone on and protected those exemptions ever since.
Yeah, I mean, it's quite difficult to summarize, but aviation policy for noise is very complex. It covers at least 10 to 15 different bits of legislation. There's no limit for aircraft noise for the public, for the neighborhoods. I think that's a key thing to understand. And this type of evidence gets fed into planning, where we set levels of where effects begin and where they become more serious to estimate effects of changing airspace or runways. But those can be set and varied across schemes. So I don't know if John would agree with me, but I think UK policy does not really protect that well people from exposure to aviation noise.
No, I would agree with that, Charlotte. And actually, noise is still pretty far down the agenda generally in the UK.
I mean, noise isn't in the Environmental Pollution Act that came out a couple of years ago. It's mentioned, I think, once in relation to car engines. Okay, so that shows you it's all focused on air quality, which is often another problem noise has.
Yeah, absolutely. Bertold.
Yes, thank you. The studies correlate their results with the outdoor pay level, but relevant, I think, is the indoor pay level. What do you mean? What is acceptable indoor level for schoolrooms?
Yeah, there's lots of regulations across different countries as to classroom acoustics. which we didn't, all we did in Ranch, we did do a survey and we could adjust for certain aspects of that. And we measured noise inside, but no, it needs a better understanding of the indoor acoustic standards, which vary a lot within countries and across countries. So yeah.
Right. I can't see everybody because there's quite a lot of people on the call, but any more questions or comments? Yes, Edavathira.
Thank you, John. It's not a comment. I just want to share our what happens here in Greece and in the area around us. We had a meeting at the airport with the association a couple of years ago. And the people of the airport, when we asked them action to be taken and at the schools, and maybe if they can insulate at least one school of our area, they told us to stop saying that because they didn't want people of the other areas to start asking for money because insulation costs. And even and that's even though we have data that there are problems in our children, to our children at the outcomes of exams, comparing with children which live in other areas. So maybe in your country they take action, but here there will be many years before taking some action about the noise.
I think that's quite a common response. I think that in particular Heathrow, I mean, this is recorded, but I think Heathrow are quite unique in that they're quite unusual in that it took time, but they did eventually start to insulate schools in 2009. This was published in 2005. I think most airports probably would respond as you've described. I don't know, John might be better placed, but I think it's expensive. It costs millions of pounds to do this to a school.
I think that's right. I think you are right about Heathrow, that they are now probably ahead of the game on this, but probably your situation you've described in Greece, Edavathira, is more typical. But but I'm not sure because we've got people from the Netherlands on the call, and I know Schiphol is doing some useful stuff. But Michael, your hand is up, and you're on mute, so you'll need to unmute yourself.
Thank you. Thank you, Charlotte, for the presentation. Would it be possible to have a copy of the presentation, please?
Yes, absolutely. And
yes, if Charlotte sends it to me, I will then I'll make it available, and it will also go on our website, Michael. And the recording goes on the website, goes on YouTube, and goes on the website probably within the next 2 or 3 days.
Okay, fantastic. I'd like to say that I've heard nothing new from the discussion. I'm involved with a group who's opposed to the expansion of Luton Airport.
Yeah.
And we'll be hearing in the next few weeks as to whether that's been given the go-ahead or not. But the airport operator is actually insulating properties. And I think there are 2 schools on the list to be insulated. What I was interested in was one of your earlier slides showing the link between annoyance, medical impacts, possibly stroke and death. One of the biggest challenges we have found has been finding some evidence that is applied statutorily to noise from airports. As you said, the only figure people are interested in is the external figure, the LAEQ figure, 16 hours or 8 hours, depending on whether it's day or night. And we can call up the WHO guidelines, but they're only guidelines. You cannot be forced to apply them.
Yeah.
It's a huge frustration because inside properties is where the noise gets through. In summertime, windows are open. And so no matter how much you insulate the property, it's still noisy.
Yeah, and insulation, you can't use your property as you might wish as well. So it's, but there are studies going on that will address those issues that you raise about indoor to outdoor. And I can, the House of Lords, when I went in to bid for them to do their inquiry, they were quite surprised about the lack of statutory requirements for the public health effects of noise. So it is, and I think there are calls in that report, I'm sure you've seen it, about what the gaps in knowledge are and what's needed. And that very much focused on intervention studies as well. And I think it mentions indoor to outdoor level differences as well.
Right. Okay.
Right.
Thank you very much.
Thanks, Michael. Any more comments or questions?
Hi, this is Debbie. I just wanted to say that, we had an insulation program around SeaTac Airport, and it was $400 million, dollars to pounds. I don't know what the difference is, but they spent a lot of money on it. Now, 20, 30 years later, a lot of it has failed.
Yeah.
So there's mold and rot and windows coming away from the walls with the expansion and shrinking. Windows are fogged, they're triple paned, they're fixed, so you can't take them out and clean them. Some even experience structural damage due to the moisture that was retained. It had poor ventilation. So we've got a lot of problems with the noise insulation program over time. And the problem with this is that it was never really tested, never really proven, never really shown to be effective. It's kind of a mess. So this has to be done properly. And at the same time, SeaTac was insulating all these homes. There was also a program going on around Boeing Field, another airport in the area, that was done completely differently. It was done a lot better. SeaTac kind of did it on the cheap, and they did it quickly. They didn't have, the best contractors, and they didn't have oversight. So a lot of this boils back down to oversight. Nobody's wanting to take responsibility, so they leave it on the airport sponsor or the FAA for oversight and compliance. So there's no checks and balances. It's a unique situation in government because there's no watchdogging of anything.
Yeah, that's a challenge. And I'm sure that's seen in other places. I should say I can't talk about it, but I am doing a study looking at the impact of home insulation on people's health and well-being as well, with the aim to sort of try and build evidence there about what works and does it reduce annoyance and things like that. So I can come back and talk about that in time.
Brilliant.
Very good.
Well, I think you're welcome back anytime, Charlotte. You can have a regular feature.
Thank you.
So thank you so much. I'm just going to hand back to Elevethera for a final few words.
Okay, thank you very much, Dr. Clarke, for being here. I just and for the brilliant presentation. And I want to inform all of you before you go that Professor Munzel confirmed willing to present flight noise and cardiovascular diseases in a webinar for WECNA at the 25th of March. So we are renewing our meeting with you for this date. So thank you all for being here. And good night to all of you.